Hello, everybody. What's up? It's your girl, BeeSparrow, BuzzzTweet Talk Radio. How y'all doing today on this Friday, July 15th, 2022? Your girl is doing fine. She's doing just fine. Thankful to be amongst the living. And as always, if you are within the sound of my voice, I give praises to the Most High Yah for waking you up too. Isn't it great to be amongst the living, even though we are living in this evil world, evil world, so much evil and so much hatred and gossip and backbiting. Wow, it's sad to say that I'd rather be amongst the living. Now, so I have to check my sound here because y'all know there are times when I've gone a whole show with no sound. And so I have to check my sound here. It seems like, wait a minute, I'm sounding pretty good. Okay, so yeah, sounding pretty good over here on BuzzzTweet Talk Radio. So my brother called me the other day and said that my dad was hospitalized, that he had caught COVID. Now, my dad is vaccinated, but he caught COVID the other day and was hospitalized. And y'all know I was hospitalized for COVID. I went in on May 11th and stayed in for 4 days. And while I was there, I had mentioned that I had an issue with blood. Like I was really having an issue with blood. And so they sent me to get a pap smear, and they found that one of my ovaries had a mass around it. And then I looked at my paperwork the other day and realized that paperwork said they couldn't even find the other ovary, but our ovaries are about the size of an almond. And so I have a mass on my left ovary about the size of a fist, a small fist. An adult small fist. First they told me it was the size of a bagel, and then the lady that looked at me, the Dr. Chappelle, she told me that it was the size of her fist, and she's rather small. And so I went to have 2 biopsies that I couldn't get through because it was too painful, and so now I have to go under anesthesia. But I just got a call from GW, George Washington Hospital in Washington, D.C., and they said that I would have to get vaccinated before I get the operation done. Now we have a problem. So I have no intentions of getting vaccinated, but now I have to get vaccinated in order to get this surgery. So now I have a lot to think about. And back to my dad, called my brother yesterday, to see how my dad was doing. He said Dad got out of the hospital and went to Burger King and got him a cheeseburger. So I want to talk about COVID a little bit. I have this article here that I want to read to you guys about the worst variant that is here now. Like I said, my operation is scheduled to be on the 26th of this month. I have to get vaccinated 5 days before the surgery, and so I have a lot to think about, a lot of praying to do, and perhaps I need to try and fast, just something I haven't done in a long time. So I wanted to talk about this new variant of the coronavirus, but y'all know, as always, I have to go and fetch my article. So let me do that, and I'll be right back. Okay? Well, okay.
What is up, y'all? You're listening to BeeSparrow on BuzzzTweet Talk Radio.
So what's up, y'all? She's back, and she is black. And guess what? I forgot my disclaimer. So I'm going to have to pull up my disclaimer while I'm on the phone with y'all. And I hope that you guys are still able to hear me. I thought that I had this set up, but like always, I'm always missing something. So I have to add my disclaimer while I am talking to you guys. And I'm going to do that. And I'll be right back. Okay? Again. Okay. BuzzzTweet Talk Radio do not own copyright for this copyrighted material, but under Section 107 United States Copyright Office, Copyright Act 1976, this video, the music and content it contains is for education and or entertainment purposes only.
All right, I know people have been sitting there, but I got to bring this queen up here. BeeSparrow. BeeSparrow. I was keeping my eye on that sparrow sitting over there with me. Come on in. What's up, BeeSparrow?
Okay, y'all, here we go. I can't call it, and y'all know I cannot call it. I just need for y'all to be extra careful out here. There is a new variant of the coronavirus. When I was in the hospital, I went in for COVID on May 11th, and the doctor told me even then that he have seen more cases of this new so-called variants of COVID than he has seen in the years that since COVID has been here. Nearly 2.5 years since the coronavirus pandemic began, the most infectious and transmissible variant yet has arrived. Repeated COVID-19 waves have left millions of people dead, with only vaccines helping to blunt the toll. Now the virus is spreading again, evolving, escaping immunity, and driving an uptick in cases and hospitalizations. The latest version of its shape-shifting BA.5 is a clear sign that the pandemic is far from over. Yes, so I'm reading from CNN.com, and it appears that a lot of people are not taking heed. I see more people without masks on. I see more people without masks now than with masks. I always remember to grab my mask when I'm walking out the door. This is very serious. And I remember when the coronavirus first hit and people was not believing that it was real. So we see now that it is very much real. My daughter contracted it, I contracted it, and my husband contracted it. I was hospitalized for 4 days. My father was hospitalized with COVID, and he's vaccinated. This article goes on to say the newest offshoot of Omicron, along with a closely related variant, BA.4, are fueling a global surge in cases, 30% over the past fortnight, according to the World Health Organization, aka WHO. In Europe, the Omicron subvariants are powering a spike in cases of about 25%, though Dr. Michael Ryan, the executive director of WHO's Health Emergencies Program, has said that the number may actually be higher, given the almost collapse in testing. BA.5 is on the march in China, ricocheting anxieties that major cities there may soon reinforce strict lockdown measures that were only recently lifted. And the same variant has become the dominant strain in the United States, where it accounted for 65% of new infections, according to the Centers of Disease Control, aka the CDC. We have been watching this virus evolve rapidly. We've been planning and preparing for this moment, And the message that I want to get across to American people is that BA5 is something we are closely monitoring, and most importantly, we know how to manage it, said Dr. Ashish Jha. I don't know if that's how you pronounce it, but that's what it looked like to me. Ashish Jha, the White House's COVID-19 response coordinator. That's what he said in a news briefing on Tuesday. On the same day, WHO's emergency committee said COVID-19 remained a public health emergency of international concern, its highest level of alert, first declared on January 20th of 2020, amid rising cases, ongoing viral mutation, and increasing pressure on already overstretched health systems. In a statement, the committee, which is made up of independent experts, highlighted challenges to the ongoing global COVID-19 response, including a drop-off in testing and spotty genome sequencing, raising the question of just how accurately any nation might reasonably be able to monitor BA5. Talking about COVID-19 and this new variant that is on the rise. So, officials' data dramatically undercount the true number of infections in the United States of this here America. Epidemiologist says. Epidemiologists. Woo! So, leaving the nation with a critical blind spot as the most transmissible coronavirus variant yet takes hold. Some experts think there could be as many as 1 million new infections every day in the broader U.S. population, 10 times higher than the official count. As for how to manage the new wave, Jha urged Americans aged 50 and older to get second booster shots. Adults who are up to date with vaccinations are less likely to be hospitalized than those who are unvaccinated. Well, my dad is vaccinated and he was hospitalized, so I don't know what the hell is going on. But okay, back to this article. Only about 1 in 4 adults in the United States over 50 have gotten their recommended second boosters. Data collected by the CDC shows. U.S. health officials are urgently working on a plan to allow second COVID-19 boosters for all adults, a senior White House official confirmed to CNN, amid fears that younger adults' immunity may be waning as COVID-19 cases rise with the dominance of BA5. So what makes BA5 different? A cardiologist and professor of molecular medicine at Scripps Research has called BA5 the worst version of the virus we've seen. He explained in a recent newsletter it takes immune escape already extensive to the next level, and as a function of that, enhanced transmissibility well beyond earlier versions of Omicron. In other words, BA5 can easily evade immunity from previous infections and vaccines, increasing the risk of reinfection. Though the variant does not appear to lead to more severe illness, in an interview with CNN, he says that given the extent of BA's immune evasion, he expects to see an escalation in hospitalizations, as we've seen in Europe and elsewhere that the variant has taken root. One good thing is it doesn't appear to be accompanied by the ICU admissions and the deaths as previous variants. But this is definitely concerning, he added. Public health experts in the United States may take some solace from the trajectory of the variants in Europe. WHO's Ryan said last week that while many European countries are experiencing a jump in hospitalizations, what we're not seeing is an increase in intensive care unit admissions. So the vaccines are very much still working, And it is those gaps in immunity that are causing the problem. But still, steep reductions in COVID-19 surveillance worldwide are hindering epidemiologists' efforts as they race to trace the virus's evolution. Subvariants of Omicron like BA4 and BA5 continue to drive waves of cases, hospitalizations, and death around the world, WHO Director General said in a media briefing on Tuesday. I'm not trying to pronounce these names. Surveillance has reduced significantly. Surveillance has reduced significantly, including testing and sequencing, making it increasingly difficult to assess the impact of variants on transmission, disease characteristics, and the effectiveness of countermeasures. New waves of the variant demonstrates again that the COVID-19 pandemic is nowhere near over, and we all should protect ourselves. Continue to protect yourselves, y'all. This is serious. You should protect yourself. Many people may not want to plan their lives around this COVID-19 anymore, especially if they're generally healthy. On the other hand, those with underlying health conditions or who have concerns about long-haul symptoms are trying to play it safe. Given just how contagious the new Omicron subvariants are, avoiding infection does require some planning and consideration. I don't think that most people should have to change their daily activities, but I do think people need to be aware of their risk of contracting COVID-19 if they don't take additional precautions. And this was said by a CNN medical analyst, Dr. Leanna Nguyen. The question to ask yourself, she added, is this: how much do I want to continue to avoid infection? For individuals who may want to reduce their risk, Nguyen advises that they stay up to date with their boosters. In the U.S., everyone aged 5 and older can receive a first booster, and those 50 and older can receive a second booster for a total of 4 shots. She also recommends wearing a high-quality N95 mask, North 95, 95 North, N95 mask or equivalent in indoor crowded settings, and staying outside for large gatherings as much as possible. Something easier to do in the summertime. For those who find masks uncomfortable, she encourage mask wearing in the high-risk settings. For example, masks while in a crowded security line at the airport and during boarding and deplanning, she added. So, listen, y'all, be careful. Be careful. In Beijing, they're making the COVID vaccine mandatory for residents wanting to enter public venues. And so, with that being said, I have something to think about. I am scheduled to go into surgery on the 26th to get this mass from around my ovary and to stop internal bleeding that I'm going through. But I just got a call today saying that I would have to take the COVID-19 vaccination before I can get operated on. Now, what is a girl to do? What is a girl to do? And I know you guys cannot tell me or give me any advice because this is the No Audience Podcast. And I know no one's listening. So no one can really give me any advice. So I would be praying to the Most High Yah that He can guide me and tell me what to do. Until then, I pray that y'all have a safe and happy weekend. It's your girl, BeeSparrow. BuzzzTweet Talk Radio. So let me know what y'all think about this. Like, comment, subscribe. not just to my YouTube channel, but come on over here to my podcast on Spreaker.com, BuzzzTweet Talk Radio. Follow me there, and in return, I'll do the same. It's your girl, BeeSparrow, BuzzzTweet Talk Radio. Holla at y'all, girl. Okay? Okay?